On today's episode of The Beats Today, we have an incredible opportunity to hear from Dr. Caitlin once again, and today with very practical solutions for everyday living. This is a time of year where our kiddos and us adults are indulging more in sweets, indulging more in perhaps improper foods. And Dr. Caitlin's information is very timely to teach us how we can practically help our oral microbiome. And also, we're going to talk about airways. This is, again, another one you don't want to miss. Welcome back to The Beats, and we have our special guest, Dr. Caitlin, today, because we had to circle back around. You know, after our last visit, she brought up a couple things that we really had to talk about, which was microbiome and the care that we give to our mouth every day. And number two, is our mouth too big or mouth too small? Is that really true? Can that ever be true? Is our mouth too small and we need to pull teeth, or is our mouth too small and our tongue is too big? Like, what is this all about? So our special guest, Dr. Caitlin from thedental.detox.com, is back with us today. She is not a dentist. She is a functional medicine chiropractor who is going to help you understand this mouth-body connection and how to care for yourself. Welcome back, Dr. Caitlin.
Well, thank you so much for having me. I love talking about this stuff with you.
I know we geek out on the mouth and we get y'all to get geeked out with us, but it's good.
But hey,
so, let's talk about protocols for the mouth. On the last show that we did together, you alluded at the end to making sure that we have proper things that we're using, proper, products that we're using in our mouth. So let's talk about what we shouldn't be using. Let's start there. What should we not be using in our mouth that we've probably been told our whole life that we should use? If she puts her hand on her forehead and goes, "Oh my God, I don't know." Are we going to get in trouble calling them all out on it? Yes, we are. But do it anyway.
You might be called to shut this podcast down or take this episode off from the next few things that are going to come out of my mouth. Crest, Colgate, Sensodyne, all of those commercially developed toothpaste, that foam, toss. They are terrible. All they have is detergents, and their whole premise is kill, kill, kill. Well, that's exactly like antibiotics. And what ends up happening is the longer we use it, the more that we're creating resistant strains of bacteria. And I don't think what people understand is we need bacteria in our mouth to start the digestion process. If we don't digest in our mouth, we're putting more pressure on our stomach. We're putting more pressure on our gut for absorbing. And so when we use things like Crest toothpaste, all we're doing is we're killing everything. We're not just killing the bad stuff, we're killing the good stuff. And we're actually increasing the likelihood of our body creating more plaque. And plaque isn't necessarily a bad thing. People think, oh, plaque is terrible, plaque is terrible. No, we're going to have plaque. Actually, your body's going to have plaque. Your teeth are going to have plaque about 24 hours after you get your teeth cleaned at the dentist with all of the scraping and the pumicing. You're going to have that back within 24 hours. But the key is you want to have good, healthy plaque. It's when it becomes a biofilm that it's problematic. Now, other than the toothpaste, it's all the dental.
Wait, before we get there. So plaque is protective in nature, right? And plaque can be a benefit to our teeth to help protect our enamel. It's only when the environment in our mouth goes in the wrong and that the plaques start behaving bad, kind of like the bacteria in our gut. There's not inherently bad bacteria and good bacteria. They either behave well or they behave improperly based upon the environment they're in. So plaque is not a bad thing. This is huge. And we need to reiterate this because I think sometimes when people hear things, they go, did I just hear that right? Did she just say plaque is good? Haven't I been told my whole life plaque is bad? Well, certain plaque is bad. Most of the plaque that we create in our mouth in a healthy microbiome, it is actually good.
It is. It's actually what allows our teeth to absorb the minerals that it needs. It's what is going to protect our teeth, especially like under our gum line from more of those anaerobic bacteria or aerobic bacteria. So plaque isn't a bad thing, but like you said, if the plaque shifts to more of a naughty or a misbehaving plaque because of the imbalance in our good and bad bacteria, our anaerobic and our aerobic, so with oxygen or without oxygen bacteria, that it becomes more of a biofilm. And what biofilms do is it protects the bad stuff. So it'll protect the bad bacterial, it'll protect the bad viruses or the fungi or heavy metals from our immune system getting in there and rebalancing, cleaning it out. And that's when we start to develop cavities, get infections, have bad breath,
So
all of those.
I have a 7-year-old who's into superheroes, right? And it sounds like the bad bacteria get a cloak, essentially. Like they get a cloak of invisible, like the immune system can't see them.
Yeah, like Harry Potter's invisible cloak.
Oh, maybe so. I don't know, but we've been watching a lot of Spider-Man lately. And so there's this cloak that the Spider-Man can use, and it makes him so that he cannot be seen by the others. So it's kind of like the bad plaque does that. And when the balance of the good and bad bacteria is not proper, then it gives the plaque this shield that allows the immune system not to be able to see it. Sorry, broke it down to the 7-year-old superhero experience, but
Perfect. Well, and when your body can't see it, it doesn't know that there's a problem.
Right.
There's nothing that it can see to fix or get rid of. And so what ends up happening is the bad stuff now have the ability to continue to replicate and take over.
They have.
So that's when we get like gingivitis, which then can turn into periodontal disease. And that's when periodontal disease is a pain in the keister to deal with. But a lot of it has to do with the oral hygiene along with the foods that we're eating.
So what are some of the oral hygiene no-nos? Like I know we talked a lot about the different toothpastes that are essentially wiping out because they're more, they suds up. You mentioned that they foam up and they make more of a detergent in the mouth where it's wiping out all the bacteria. And I think that a lot of people think, oh, don't I want to use a detergent in my mouth? But the reality is they don't necessarily want to use a detergent in their mouth, correct? You're back.
Yeah, correct. 100%. We don't want detergents. Detergents are, it's like bleach. You don't want to bleach your stomach. You don't want to bleach your, digestive system. So we don't want to do it in the mouth. Because think about it, guys. Remember, mouth is a tube.
Right.
It's all connected. The other thing outside of toothpaste, or do you want to keep talking about toothpaste?
No, that's great. So toothpaste, a lot of them are detergents. And if the more foamy they become, probably the worse they are for you. Because that's a complaint I get all the time when people start switching their toothpaste. It doesn't suds up like my other one. Great. Same with your laundry detergent. That's the not salicylic acid, the sodium lauryl sulfate that causes it, the SLS that causes it to suds up. And that doesn't do anything but make your mind think that you're getting something good. It has no effect other than a negative effect on cleaning anything in your life, just to let you know.
100%. I tell them that with like dish soap all the time. It
Right.
doesn't have to be big and sudsy and overflowing your sink to get your dishes clean.
Right.
Same with the mouth. The other thing that we have to be cognizant of is mouthwash. Mouthwash is awful. It is just like essentially alcohol that is doing the same thing. It's just killing. So yes, you're killing some of the bad stuff, but you're not rebalancing anything.
You're not creating an environment that's going to cultivate the good stuff. And we get the good stuff from the food we eat, from the air we breathe, from exposing ourselves to life, not staying in a house with a mask on, perhaps. But I didn't mean to go there, but I just went there. But let's take that out of the equation. Let's say that's not part of the equation. I don't want a toothpaste that's going to suds up and kill everything. Now I don't want a mouthwash that's going to essentially stringently deal and like kill everything. What's the one my parents used to have all the time? It was really strong, yellow in color. I can't remember. Listerine. Yeah. Whew.
If it burns, don't do it.
Oh,
It's
I remember growing up going, that feels like a shot of whiskey. Like that does not feel like it's good for me. And I'm so glad I just was adamantly opposed to doing them now. But everybody gave me a hard time when I was a teenager because I wouldn't do those particular mouthwashes because I didn't like alcohol. I still don't. And so anything that tastes or flavored like alcohol, I just am, it feels like it's drying. It feels the opposite of good for me. So are there any good mouthwashes out there? And why did we end up starting to talk about mouth? Not that we, but in general in life, how did mouthwash even start? Do you have any idea?
It was more to promote healthy breath. So your breath stinks, here, have some gum, use some mouthwash. But if you have stinky breath, it means that there's that imbalance in your oral microbiome. And by killing everything is not allowing the good stuff to repopulate. So you're not really doing, you're not fixing the problem, we'll put it that way, from using mouthwash. You're actually perpetuating it and making it worse long term. There's another one that is talked about quite a bit um, in the dental world, and I'm going to tell you guys, don't do it, especially long term, which
Ah,
is hydrogen peroxide.
yeah,
Stop with the hydrogen peroxide. It's doing the same thing.
yeah.
It's wiping you out of good and bad. It's not just getting rid of the bad. And so I cringe when people come and they're like, oh, my dentist told me just to swish with hydrogen peroxide. It'll be fine. It'll get rid of, the plaque on my teeth. It'll make my teeth whiter. No, you don't actually want to do that long term. If you're going to do it because you have an infection that's being dealt with for a short period of time, fine. But you gotta be using really good like pre and probiotics for your mouth then to help rebuild it, because you're wiping it clean. And I know there's going to be some dentists out there that are like, what in the heck are you talking about? It's because that problem is going to translate or translocate into the gut, and then you're going to deal with the bigger problem. So
Because often
please.
bad breath isn't just from the mouth, right? It can come from the gut as well.
Uh-huh.
So if you have bad breath, those are linked. And the other thing that a lot of people do is oil pulling. Like a lot of our clients do oil pulling, like they start it and then they don't stop it for years on end. And I feel much like you do the hydroperoxide, like that's okay in a short-term experience, like hydroperoxide 2 to 3 days, maybe a week. Oil pulling 2 to 3 weeks, maybe a month right after some kind of dental procedure has been done, and then stop it. Just stop it. Just stop.
Well, it's not meant for long term. It
Right.
really isn't. And there are other things that you can do that's going to be far more beneficial. Like I tell people all the time, there's a few things that people need to incorporate for oral health, oral hygiene, so that long term their mouth can be healthy. They're not going to be losing teeth. Their teeth aren't going to get loose. They're not going to end up with like needing root canals, or they're not going to end up with a systemic problem. But the big things that they got to start doing is, one, scraping their tongue. Like
Mm.
get rid of that buildup of that like film, that biofilm layer that builds up on your tongue. It could be yeast, it could be bad bacteria. You got to brush the roof of your mouth. You got to brush your cheeks, like the inside of your cheeks. We got to take care of our whole mouth, not just our teeth. But then the other thing, outside of flossing, because the thing about floss is it actually doesn't get deep enough into the pockets. And what you're doing is when you floss, you're actually pushing bacteria further up into your gums versus pulling it out. Better off getting like a water pick and doing water picking, because what it's going to do, it's more like an irrigation system where you're shooting water up and it's coming down and pulling everything with it. So not just like the food particles, but it's pulling the bacteria out. And what you can do if you want to restore balance more, if you have an infection or if you're fighting something, throw in baking soda. Baking soda is far more basic. And normally when we have either bad breath or we have an imbalance in bacteria, it's because our mouth is shifting towards a more acidic environment. If we can bring it back to more neutral using, baking soda, you're going to see far better results long term, especially like teeth sensitivity it's usually due to infections. And if we can get those infections out by rebalancing the pH, you're going to be far happier in the long run. So dump the mouthwash, dump the hydrogen peroxide, get a water pick and throw some baking soda in there, or just do plain old, don't do tap water because that's full of garbage anyway, but just do a water pick, and that will make a massive difference in the health of your teeth and gums.
And we just, I was just at one of our biological dentists, and we were talking about my son, who's 7, whose front teeth are yellowing more than all his other teeth. And I'm really adamant about his oral hygiene, as you can imagine. And we're really adamant about which toothpaste we use. And yet still his adult teeth that he's only had for about a year are yellowing, the front teeth. And first of all, she mentioned, the hygienist mentioned that will happen, that just in general, the regular color of his teeth will start to come out more as an adult teeth than baby teeth. But number 2 is that's often plaque buildup. And even though he's brushing really well, to use an electronic toothbrush is very successful. And I said to her, like, listen, you guys tried to get me to use one 4 years ago, and I can hardly handle it. It tickles me so much in my gums. So she's just suggested a different brand. She said instead of Sonicare, go to Oral-B. So I got the Oral-B over the weekend. I have never seen my son so excited about brushing his teeth. Like literally, he wanted to brush his teeth 4 times the first day. And we're like, you can overbrush your teeth, like stop. But he's holding it on each tooth and up in the gum and behind and holding it. And one day his teeth look so dramatically different. And he loves it. Like I honestly thought as a 7-year-old, he'd be a little resistant to the electronic toothbrush in his mouth, but he's all about it. And so I encourage you, if you have children, you have elderly, or you have somebody who isn't doing as great of procedure as you would like, to go ahead and get the electronic toothbrush, because I'm sure, like the water pick, and some of them have 2 combined now, where you have the water pick with the electronic toothbrush, it much replicates the cleaning experience when you have the proper toothpaste with it.
Well, and you bring up a really good point, because most people aren't brushing long enough to make a big enough difference, meaning they're not getting rid of the buildup that is naturally going to happen just from, you know, the food that we're eating, if we're breathing through our mouths, if we're talking, whatever we're drinking. So we have to be more diligent about taking the time to properly brush our teeth. And the nice thing about having like a mechanical toothbrush is it does the work for us. It literally tells you like when to move, kind of thing. And sometimes it's by quadrant, like, you know, it'll give you 30 seconds for like your top half of your mouth versus the left half, and then you just move it, and it makes it so much easier. I'm actually looking into a different toothbrush. It's not Oral-B, it's not Sonicare. I don't have all the information on it just yet, but if I find out that this one is even better, I'll let you know.
Let me know.
I don't want to drop the name just yet. I don't want to promote something that I'm not 100% behind just yet, but it looks promising. So I will let you know what I find out with this new brand.
Let us know. And, you know, I know this is like, oh my gosh, why are we listening about teeth? I just turned this on and oh my gosh, she's talking about teeth again. But we really want you guys, everybody, to understand that in order for you to truly flow, for you to have overall wellness in your body, you got to handle your mouth, and your dentin is the primary. I am not a dentist. Dr. Caitlin is not a dentist, but boy, I can tell you the majority of our life is spent talking about pooping and dentistry. And if those 2 things aren't going in proper, if you're not eating, like she mentioned on our previous podcast, if you eat 3 times a day, you should poop 3 times a day. You should clean your mouth at least 2 to 3 times a day. You should have proper protocols with your teeth. You should never miss your protocols with your teeth. Your teeth will tell you how healthy the rest of your body is. This is a key understanding. It's not that we want to just send you to the dentist. There's not much of our bodies that want to send you to the dentist, other than we want to make sure that you handle your body properly, and you understand how your body is affected, that your teeth affect every other aspect of your body. And it's really important, not only the proper protocol and procedure, but the bigness of our mouth has a lot to do with it. And I would like to tell everybody who's listening to me, who's listened to me at all, that I have my whole life struggled with my mouth not being big enough. I swear to goodness, that's a real statement until about 5 or 6 years ago, when I finally worked with our biological dentist and worked on my airway. And then Dr. Caitlin, because I always bit my tongue, my cheeks. I always felt like, what the hell, man? God just gave me a tongue that's too big for my mouth. I can't get it around as much. I used to trip over my mouth, over my words often in my mouth. My tongue would get caught up in the way. I'm like, what the heck, man? My body just wasn't created right somehow. My tongue is too big. And then Dr. Caitlin was told as a young child, right? You had that done as a young child, that she had to have
too big for my mouth.
You have your teeth were too big for your mouth. So your teeth are too big. My tongue was too big, but the reality is none of that's true, right? So shed some light on the subject for me, Dr. Caitlin. What does this mean?
This means that if you've ever been told your teeth are too big, your mouth is too small, your tongue is too big, it ultimately means that your palate didn't develop properly. So your jaw, your lower and upper jaw that house your teeth, didn't expand. It didn't develop appropriately. And so when our jaw is too small, of course, our teeth are going to be too big to fit in our mouth. And this is where crowding happens. So this is why so many people have crowded teeth and end up with braces. But braces for me wouldn't have even been enough because there wasn't any room for them to even move my teeth around. So what they did was they pulled out 4 teeth. They pulled out my precanines, because who needs those? We don't need those teeth. No big deal.
Oh my gosh.
And then we pulled out my
wisdom. Can't see me. It makes me very emotional. I think somebody told her she has extra teeth.
Yeah, it's okay. We don't need those teeth.
You don't need those for chewing or mastication or alignment of your meridians in your nerves. We don't need those.
No, not at all. Not at all. For proper swallowing, for proper immune system function, we don't need those. For proper hormone, any of that.
With extra parts. Little did you know, you had spare parts. You're like IKEA. Every time I put something together with IKEA, I'm like, oh, there's an extra screw or nut or something. That's curious.
Yeah, we'll have to talk about tonsils being spare parts at some point.
Yeah.
But so what ended up happening was I had those removed, I had my wisdom teeth removed, and I had braces not once, but twice, because my teeth shifted. So I had braces, I wore them for like 2.5 years. I had beautiful straight teeth. I wore my retainers to make sure my teeth didn't shift. And then, 3 years later, they're like, you're good. You don't have to wear them anymore. Well, sure enough, my teeth shifted and I had to wear them again. So I had to get braces put on a second time. And yet again, my teeth shifted because my mouth actually isn't big enough. And some ways that you can look at this is, okay, how do you know if your mouth is big enough? Well, the tip of your tongue should sit right behind your 2 front teeth. And you should be able to flatten your tongue against the roof of your mouth. So it should lay nice and flat against the roof of your mouth. If any part of your tongue overflows over your teeth, if you have to like squish your tongue to get it up there, it means that you don't actually have proper development of your jaw. And when you don't have proper development of your jaw, your upper teeth, the roof of your mouth makes the base of your sinuses. So if you have a really high arch, like a lot of people do, if you look up, like open your mouth again, guys, we got to look in our mouth. If you look at your mouth and the roof of your mouth looks like the peak or the roof of a house, that's bad. You want to have a nice...
She's talking about the palate, and the roof of their mouth is the same. Okay. And this is the floor to our sinuses. So what we want you to do is open your mouth, look at the top of your mouth, because a lot of people think jaw is only the bottom, but the jaw is the top and the bottom. So when you look at your jaw, you got to open your mouth. You got to look up at that top arch behind the teeth in the middle to see how narrow is it, how peaked is it, how sharp is that, or is it more of a dull arch? Think about your archway in your house. Do you have round arches? Most people have square arches, but for doorways, but some people have round arches, or is it more like a peak, as she mentioned, like the roof, like an A-frame type house would have an A-frame peaked roof where it's all going to come up to a point. So is your point really pointy, or is it kind of dull and going across? So take a look in. That is talking about the palate.
We want it to look more like a rainbow is how I talk to kids. We want the top of our mouth to look like a rainbow.
Nice and curved and archy, but broad, not not pointy.
Because when it's pointed, our sinuses are really, really small, and that causes airway obstruction. So a lot of people will, like myself when I was younger, have massive sinus issues, whether it be congestion or sinus infections. You know, you're prone to it because you were just born with small sinuses. No, I was not born with too big of teeth and small sinuses. My mouth didn't develop properly.
And what would cause the mouth to not develop? Let's just jump off for a second and talk about that, because I know that, so a lot of people are listening to this, are going, yep, that's me. My mouth is too small for various reasons, but why? Why did I not develop properly? Is that something I didn't do? Was that something I personally am a problem child and I didn't develop right? Is this genetic? What is the reason? What are the reasons behind this lack of development, Dr. Caitlin?
So the biggest one is now a lack of breastfeeding, unfortunately, because what happens is we start to develop our jaw from the suction that we're supposed to make on a breast, because the breast is different than a bottle and it utilizes different muscles. So when we're sucking on a bottle, it's causing a narrower, sharper peak for the top of our mouth. Versus when we have to suction around a nipple, we're having to use different muscles. So that makes for a broader jaw. So that's part of it. And I'm not shaming moms who couldn't breastfeed or anything like that. But then what we've done is we've moved on to everything is soft. So everything is like in those squeeze pouches, like the applesauce in the smoothies for kids. And then everything is pureed. Like we're not getting kids to actually like masticate, like chew, right? Whereas.
So she's having a little technical difficulty, so I'm going to just step in for a second. So one of the things we're talking about is the mouth, because we aren't breastfeeding. It's not that we're not breastfeeding, it's actually the length of time. So even if we breastfeed, if we're not breastfeeding for a total of 2 to 3 years, oftentimes that palate doesn't have the time to expand as much as it does. Sorry, there was a little technical difficulty, so I was just stepping in to explain the palate expanding a little bit from breastfeeding. So we got that, and we got that it's not just that we're not breastfeeding. I just mentioned it's the amount of time we're breastfeeding. Again, it's not to shame anybody that's not breastfeeding. It's just to make an awareness that due to the fact that we don't breastfeed for 2 to 3 years, the palate doesn't expand in that way. Then in combination with that, when we're not asking our children to gum hard things, we're afraid they're going to choke. So instead of choking, they're gnawing on nothing. They're not gnawing, they're sucking down pre-digested food essentially, so they're never masticating. And when they don't masticate, what happens? You're back now. What happens when they don't masticate? When they don't masticate means chew. When they don't chew on food or try to gnaw on hard carrots or hard things when they don't even have teeth. Why is that important?
Well, that's literally going to create the development of the jaw, because our jaws develop at a really young age. And so if we're not chewing, we're not utilizing certain muscles, we're not pushing in certain areas of our jaw. So we're not training it to be big so that we can, you know, eat those carrots or dig into, you know, a steak or whatever it may be. We're literally training our body just to eat mush. And that's one of the reasons, or probably the biggest reason, as to why we have such underdeveloped jaws these days. That's another reason why, you know, we don't have room for wisdom teeth. Everybody needs their wisdom teeth out now. It's because their jaws aren't big enough.
And a lot of that is the food we're choosing, but it's also that we're not asking the jaw to do that type of work anymore, which, you know, there's a whole philosophy as to why we don't need wisdom teeth anymore, but we do need to masticate, we do need to chew, we need to widen that palate. And when we chew, it actually stimulates the stem cells within the roots, and the stem cells denote new growth, and that's how the bone and the palate expands, is with the growth when the actual chewing occurs. It also happens in our sutures of our head, that when we chew, it allows this to expand, because the jaw is innervated by more nerves than any other part of our body, and it has a lot to do with us being actual human beings. And chewing rather at the jaw is going to allow this palate to expand. So tell them your story quickly. What happened? Because I can hear that my friend Caitlin is talking a little differently than she was when I saw her in November. So what's occurred for you since November?
Well, my biological dentist is like, okay, girl, look, if you don't take care of your airway, because I had a cone beam done, which is a 3D scan, which is what showed me that I had 4 really bad cavitations, infections in my bone. But that also showed that my airway was really narrow, and that when you have a narrow airway, the likelihood of having sleep apnea is almost guaranteed. And sleep apnea means that you're not getting oxygen while you sleep. And if you're not getting oxygen while you sleep, you're killing your brain.
Yeah,
like,
that's slightly important. Getting oxygen while you sleep is like top one thing you need to do when you sleep is get oxygen.
Yeah, well, and when we sleep, that's when we heal. And so if we're not getting oxygen, we can't heal. We can't grow, we can't balance hormones, we can't heal, we can't do any of that. And so I was not okay with all of a sudden developing dementia, because dementia is linked to sleep apnea, cardiovascular disease, hypertension. I was like, okay, what do we got to do? And so we had to expand my jaw. The size of my jaw was that of a 6-year-old.
Wow.
Yeah, so when we measured it, my jaw was that of a 6-year-old. So what I started with was a DNA appliance, because I wanted the ability to put it in and take it out so that I'd be able to talk, because I have to talk for a living. And if people can't understand me, I'm not going to be able to help anybody. So I wore the DNA appliance for about a year. I broke my bottom one, so I was waiting for the bottom one for a new one. And finally I decided, screw this, let's just get the permanent one. So I got a permanent palate expander put in. And by permanent, I don't mean I'm living with it the rest of my life. It's just I can't take it in and out. And in the last 2 months, my jaw has expanded probably 5 millimeters, and that's huge. My smile right now is a little different. I'm not used to it because it's like in between. But what I'm finding is I can actually put my tongue on the roof of my mouth. It's still not perfect. I still need to expand it a little bit more. But when I sleep, I'm actually able to get oxygen in through my nose. I'm waking up more rested. I do tape my mouth at night, because growing up, because I couldn't breathe through my nose, because my palate was pushed up into my sinus passages, which made it really hard to breathe. I still have to tape my mouth, because it's like a trained thing in me now. It's just like automatic. I go to sleep and I open my mouth. But if I tape my mouth, I force myself to breathe through my nose, and it's night and day. It's been unbelievable. So that's why I have a little bit of a lisp, as I got an upper and lower expander in. But it's ultimately to prevent me from developing cardiovascular disease or dementia.
And if we don't breathe well, we don't heal, and then that allows all those bugs that like the no oxygen environment to thrive, right? Rather than living in oxygen, which really helps balance the pH. I mean, when you get the pH right, often through oxygen, through nitrous oxide, which you get by naturally breathing in through your nose, it sets your pH proper. So it's really key to understand that your mouth isn't too small, you don't have too many teeth, your tongue isn't too big, your palate was never developed properly. And Dr. Caitlin, did it hurt when you did this over the last 2 to 3 months? I mean, it sounds like, oh, I'm expanding my palate, you know, it sounds torturous. Does it actually hurt?
So as an adult, it's going to be more uncomfortable because we are more set. Like our sutures and everything's more set. Really, what should be happening is we should be dealing with this in children. So as young as 5 years old, you should be taking your child to an airway specialist to get this figured out, because ultimately you can fix it as a young child far easier than it is to fix it as an adult. Now,
Great.
is it torturous?
Really good point.
I would have rather have not worn braces twice and now do this, honestly, and still have that set of teeth that I should have. But is it torturous? No. I'm actually being a little more aggressive with my appliance. I'm cranking it more because I'm one of those, like, let's do this, let's get her done, let's do it properly. I'm taking things to support bone growth and all these other things. But it's uncomfortable for a night. It's completely changing my bite, which is what I need. I need my bite to change. So I'm having to change how I chew. It's making me far more cognizant of how important chewing is for digestion. But is it worth it? 100%. Is it torturous? No, I wouldn't say that. Is it like a walk in the park? I definitely wouldn't say that either. But it's 100% worth it, in my opinion.
And there's a lot of myofunction that has to be done with that. So it's not just wearing the appliance, it's changing the muscles and the fascia and the lymphatics to improve drainage. Because a lot of people, when we start doing this, we instantly start to notice that we get postnasal drip, we get drainage because our sinuses are opening. As you mentioned, that palate has been restricted. Now, as we open that palate's no longer restricted. The sinuses can drain not only from into the parotids, but into the tonsil area and down into the termini, so it can get a better drainage.
Well, and a lot of people find that they end up with sore throats, but it's that postnasal drip that has just built up, that slowly it's like, oh, I now have room and I can now essentially decongest, get rid of the gunk. But no, there's a lot of other work that has to be done. Like, I'm going to need a tongue tie release. Mm-hmm. But I have to have room for my tongue before I get the tongue tie release done. Otherwise, the tongue tie is just going to
cause more issues than it would not. Yes. Well, this has been awesome. We have had a couple technical difficulties today, but we've still gotten Dr. Caitlin's message across, which is certainly to pay attention to our protocol in our mouth to make sure that we're not undoing all the good probiotics and bacteria and enzymatic production from all the great food we're eating, to make sure that we're supporting a good balance of microbiome in our mouth. And then in addition to that, to support that system through oxygen, through making sure that we get the most amount of oxygen by breathing through our nose and having the proper palate to make sure that we're breathing. So Dr. Caitlin, is there anything else that you'd like to share with us today about the microbiome or about the airway, and which are two things that you've brought a lot of people's attention to? And I'm sure you're going to be in lots of emails on the dentaldetox.com, which is where you can find Dr. Caitlin. But what else did you want to enlighten them all, if anything?
Stop killing all of the bacteria in your mouth.
Yeah.
That's not going to do anything. Try and get more of a natural toothpaste that doesn't have, the detergents, the astringents in it. And then the other thing is, tape your mouth and tape your kid's mouth during the day so that we can force breathing through the nose. That is so important for brain health and overall function, not to mention proper mouth development in young kids. So if you do it during the day, it's not as scary. I use the 3M Sensodyne tape because it's easy to put on and off. It doesn't hurt. And then you can work your way up to taping your mouth at night, because most people are like, oh my gosh, that's so scary. I'm not going to be able to breathe. I'm going to suffocate. It's not like that at all. But practice during the day and it'll make it less scary at night to tape your mouth and get more oxygen to the rest of your body.
More practical solutions from Dr. Caitlin here at The Beats. From our heart to yours, we truly want to help you get the best results you can, and we know that that happens by treating your mouth properly, and the rest will follow. Thank you so much, Dr. Caitlin, for all your wisdom, your advice, and your practical solutions for everybody out there to learn how they can best treat their mouths so their bodies can be treated as well as they treat their mouths. Thank you all, and we'll see you next time at the Beats with Kelly Kennedy.